Hello and welcome to the People Power Lunch Hour Show. I'm your host, Vanessa Maria Graber. On today's show, I'll be talking with Tashina Okorie, who is a PhD, who's the Program Director of Community and Professional Training at the Community Health Training Alliance, and also with Chvasta, who's the Public Programs Associate, also working with the Community Health Training Alliance through FIGHT. And the Community Health Training Alliance is a community and professional training program that offers a year-long series of public workshops, conferences, webinars, and symposiums on health topics that affect communities affected by adverse health determinants. We'll talk about all that and more on this edition of the People Power Lunch Hour Show. People Power Lunch Hour is broadcasting live on Philly KM TV and WPPM 106.5 FM. Stay with us. We'll be right back. Welcome back. Hey, welcome back to the People Power Lunch Hour Show. I'm Vanessa Maria Graber, and today we're going to be talking with two organizers from the Community Health Training Alliance. And as I mentioned earlier, it's a community and professional training program that offers a variety of educational opportunities for organizers, service providers, and people working in the field of public health. They're going to talk about their programs and services and this coalition, which is a community-wide initiative about African American history, health issues, women issues, reentry issues, and more. I'm joined on today's show with Tashina Okorie, who is the Program Director of Community and Professional Training at the CHTA. Welcome to the show.
Thank you for having me.
And also Chvasta, who is the Public Programs Associate with the Community Health Training Alliance. And you all both work at FIGHT. FIGHT is the main facilitator of this alliance.
Mm-hmm. Yes, that's correct.
So FIGHT, Philadelphia FIGHT is a pretty big organization here in Philly, has a variety of programs working in public health, but mainly dealing with folks affected with HIV, and has grown exponentially in the last 2 years and also contributed significantly to the decline in the number of HIV cases contracted every year. So that is really amazing work that you are all doing, and I'm really glad to have you here on the show.
Thank you.
So the Philadelphia FIGHT organization and also the Community Health Training Alliance is part of the Technology Learning Service Collaborative, which Philly CAM is a part of. And it's a really great coalition of organizations working together to use technology and also involved in education. So you have been coordinating AIDS Education Month, which is in June, even though we're wearing red.
We're excited about it.
But it's become so popular and effective that you kind of expanded this program. Can you tell us more about that?
Absolutely, absolutely. The Community Health Training Alliance is rooted in a tradition of public programs and public educational programs that historically has taken place just in June. It started off really small, I believe, at lectures and workshops all throughout the city. I think it started actually at the William Way Center, if my institutional memory serves me correctly. Someone could correct me if I'm wrong, but it's grown really fast. We see about 15,000 people at our summits each year. But the one bit of feedback we always get year after year is we want more. We want more workshops. We want to be able to see more symposiums, more lectures, and that's kind of what we're doing this year. We're offering a whole suite of programming all throughout the year, starting in this month, actually. So, and with that, we brought on Tashina to kind of lead the Community Health Training Alliance.
So I'm the newbie to the organization. I just started there in January, so I'm really excited about AEM Month and Cheetah Alliance. That's a new kind of initiative within FIGHT to provide year-long training. And so I'm excited because this is my first prevention summit, And so I'm really looking forward to being a part of the summit to, encourage, to inspire, to educate, and, really promote the Community Health Training Alliance all year round to really talk about different public health matters that affect people with HIV, around like mental health, substance abuse, and things like that, I think it's important to dispel some of the myths or stereotypes, or just having some education around what it is and what it isn't. And so we are, putting together various webinars. We have one in February coming up, Nothing About Us Without Us, actually this Friday. So we're super excited about that. It's our first webinar as part of CHEETA, which is the short version of Community Health Alliance, Training Alliance. And then we have two coming up in March. March 16th, I believe, is the Agape Love.
Agape Love, Love After a Positive Diagnosis.
So I'm super excited about that webinar because the Treadwicks are the presenters for that, and they're speaking to, love after being diagnosed. And oftentimes people who are living with HIV may lose hope in that area. Like, who's going to love me? Am I going to be married? Am I going to have kids? Or, because of the stigma behind having HIV. And so their love story, they share about that and how she worked through that, and her husband being negative. And so they talk more about that in the webinar. And so we're super excited about them being transparent about their story through this webinar presentation. And we have another one in March 30th.
Yes. And that one is about the intersection of intimate partner violence and HIV, and it's given by a great group of folks who do advocacy and activism work around this, and there's going to be resources provided and kind of break down how that works out. It's going to be a really great webinar. So we have a host of things slated.
So we're excited about that.
So can you talk about who the target population is? Like, who's able to access these webinars and events and workshops that you have scheduled for the rest of the year?
Well, it's open to the community, so anyone could attend. The webinars are free. We're doing it through a Zoom conferencing platform. The audience, we're speaking not just about HIV and AIDS, but also about other various topics in relation to other, as I said, public health issues. And so, you have those who are in the community who are living with HIV. You have those who are maybe social workers who may attend the webinar, teachers, family members. All are welcome to attend.
So most of the events, or almost all of them, are free and they don't have to pay, which is really great because it seems like you have professionals and people with lived experience who are able to share their knowledge with the public.
Exactly. And that's what makes it exciting, because we have a variation of people who present and share lived experience, those who are doctors who can speak from more of the medical perspective. I think education is liberating. The more information you have, the more you have a better understanding of HIV or other topics. And so I think that's what makes our AIDS Education Month really significant, because we do a lot of education around that, around HIV and AIDS. And it's come such a long way from when it first came on the scene. People seen it as a death sentence, and now there's so much happening in medication where people are living longer. That is no longer a death sentence. People are having children, or getting married, and having normal lives. What's normal, but you know what I mean. They're having lives, and it's important to be able to show that, so people who may not be familiarly understand HIV/AIDS. Can hear it from attending our workshops, seminars, or our conferences and things like that. And so we have a lot of people, who are interested in being presenters. We're really excited about, people submitting workshop proposals. So we're actually looking for that also, really promoting people who have lived experiences or professionals who are interested in being a part of the prevention summit to submit workshop proposals to be considered to be a presenter. And so that's super exciting to hear the things, the ideas that's coming our way about things that can be taught as it relates to the community of folks living with HIV and AIDS. And so we're excited about that also.
Can you talk about some of your partners? Like, what are some of the other organizations or communities that you're working with here in Philadelphia?
Oh, absolutely. We have such a great group of folks that we work with regularly, and we're always open to working with other organizations that work in HIV/AIDS and allied issues. So we, some of the folks we work with, just off the top of my head, we work with the AIDS Fund, AIDS Law Project, Action Wellness, to name a few. And we really reach out and try to forge relationships and be conveners of these agencies to create quality public programming, quality education. We have a list of our planning partners on our website on AIDSEducationmonth.org. It'll give you a little more comprehensive list of folks that we regularly partner with and put symposiums on and lectures and workshops. For instance, in April, we're having a symposium called Philadelphia's First Anal Health Symposium, which is about anal health. And we're going to rap about anal sex, anal health, how to stay healthy, you know. There's going to be a number of experts on the topic, and that should be great. And also, for instance, another partner that we work with regularly is CHOP. And CHOP during AIDS Education Month puts on what is called the Kiki Ball, which is a youth ball in the drag tradition, you know. So that's really wonderful. And we also put on an event with CCP in June, where we have a lecture about current public health topics. It could be anything from the opioid epidemic to housing, So we really, really work hard to, work with folks that are doing things within our field and allied issues. So there's a host of people, and we're always open to working with new folks. Like, we've worked with PhillyCam for so long.
That's right.
So.
We should do a media training, right? How to tell your story, because I think that people being able to share their story and tell people is really how other people are maybe motivated to get treatment or to get counseling or to come to events like this. And I see that you have also a faith leaders lecture too, which, a lot of people, that's a connection to their health as well. And then you have a tech health and wellness webinar series too. Yep. And then there's also a reentry summit and prison healthcare. And so in 2 weeks, we'll have some organizers from there also talk about reentry on People Power Lunch Hour. And there's also a connection with people who are incarcerated and coming out of prison, of course, who are also dealing with HIV. Can you talk more about this kind of like partnership and how you have kind of grown to work together to address some of these issues?
So historically, I believe this has been something that has been a part of the AIDS Education Month in June. I'm going to speak to more about how that connection works.
Absolutely, absolutely. So part of the reconfiguration of AIDS Education Month was taking the Prison Summit, which was always in June, and giving it its own month, giving it its own feature and spotlight. And Asada Thomas is going to be here in 2 weeks to speak more to that. But one of the biggest issues that Asada and the Institute for Community Justice addresses is healthcare, as folks are in the process of reentry, and connecting folks to healthcare and connecting folks to resources as they're taking that journey into reentry. Because I can't speak fully to the issue because Asada is an expert on that, but it's about getting folks what they need, and justice, restorative justice, and all of those sort of issues kind of intersect, and that's what the Prison Summit speaks to, and that's what we've done for many years, is kind of get that information out to the public through the Prison Summit. And like a great workshop that gets featured not time after time, but sometimes is about jobs. Where are the jobs at? What are unique pathways to find jobs? That's like some of the content. That's just one of the workshops that we put on at the Prison Summit. Or ban the box. That's another issue that the Prison Summit speaks to, is, get rid of the question on job applications, asking if you have a felony, you know? So we just try to do stuff like that. So,
But it seems
Speak
like
plainly.
there's just a greater need for it, and so it's really great that it's been able to expand and have its own month
Yeah.
and get more participation and partners for it. We're part of the Reentry Reporting Collaborative,
Yes.
which again is another issue that's just like kind of like really grown and become its own thing. So it's nice to see that we're all overlapping
Yeah.
in this way. It seems like a big part of what you do is connecting people to resources and the community. What are some of the biggest challenges for your population in terms of knowing what's available to them?
That's a good question. I think this has been probably some of the ongoing challenges that presents itself within, communities that lack resources. So it could be literacy that they struggle with in accessing the resources that's needed. I think, unfortunately, sometimes they meet some other health issues that enable them to actually physically go out to get such resources. I think that what makes Cheetah Community Training Alliance important, because we can maybe help connect those folks through training, through workshops, through other professionals, and kind of speaking to those needs to help create kind of a form or format to help those individuals better access such resources. I think we can add to that around training. What are your thoughts around that?
Well, if I might
Yeah.
add, I think it's like community places like Philly Cam have a lot of influx of people coming through the
Yeah.
door. So the more that we know about community resources, right, the more we can refer people and connect them to things that would be helpful. But I think a lot of people just are unaware
Yeah.
what's out there, and that there's actually a lot of free programs and resources. And not only that, but that there's a whole community of other people that will support them if they have HIV. I think because of the stigma, people might feel really alone and isolated. And so part of what you're doing is opening them up to this community, right?
I think what's also awesome about Philadelphia Fight is that we have other programs within the organization that also reach out to the communication to help spread awareness of resources that's available to them. It's like specifically our AIDS library is transitioning into the Critical Path Learning Center, which is an exciting time right now, where we will then offer resources around laundry services. I think they're going to have a place where people can find resources to take care of their the cleaning of household things they need in the home, or access to GED, and learning how to access various things through digital literacy. And so they're excited about this transition to expand within Fight to offer more resources to the community. And it's our hopes that we make enough noise so people around the neighborhood and around the communities and other service providers will come to know what we're doing, some of the new innovative things that we're doing to reach the community at large, to help them find more resources, become more skillful in accessing services as well.
Do you think that, with all of the proposed cuts to federal programs, that resources are growing, or are they shrinking? Like, what do we as a community need to do to advocate for this population? And is advocacy, like getting people to advocate for themselves, kind of like part of this as well?
I think it's been an ongoing challenge, when you're experiencing cutbacks financially, funding. Of course, that hurts services because we can't offer what we need to. So we have to compensate in other ways to make sure those services are still available to those consumers. Is there an easy answer as to how we could deal with that system-wide? I think this has been an issue for a very long time. I think with Philadelphia Fight, they've been doing this for a really long time, where they've established connections within the community. They've established partnerships that support the cause of Fight to be able to continue services, despite some of the funding that may have been cut, that we may have experienced, we're still able to offer services to the community. And so but that's a tough question, because I'm sure that issue is, in terms of funding, plagues a lot of organizations that's offering services to the community, and unfortunately programs are cut. And so then where do they go? I'm thankful just in knowing FIGHT has been around for so long, that has withstand some of those cutbacks that other organizations have experienced, that we're still able to service the community, regardless of what's happening around funding or these things, within the community.
Yeah, I say that because I've seen FIGHT members be part of delegations going to Harrisburg and going to Washington to advocate for healthcare, not just like treatment for HIV, but just healthcare in general. And it's nice to see that people who are part of the community can then, through education, begin to talk about their experience and then advocate not just for themselves, but all the other people that can't make it out. So FIGHT has a long legacy of, instilling leadership, right? Because a part of this is kind of developing community leaders and getting them to share the education with others, right?
That's a good point, because we have project teach rather. And you're right, being new to the organization and just observing and getting to know the individuals there. You're right, there are a lot of individuals who receive services, who have been through FIGHT, throughout FIGHT for years, have become advocates because of Project Teach. You have Project Teach, you have Outside Teach, you have Women's Teach, Faithful Teach. So we have a lot of different programs to teach our individual folks who are living with HIV. We have programs for those in the community who may not be living with the virus but are affected by it, can also become advocates. We have those in the these are my train of thought, the communities of faith, who can also receive the training to become more informed to how we can better service people living with HIV within the church, but also within the community. And so FIGHT, that's something special about FIGHT, that they have that vehicle to not just be of service, but to raise leaders to also become advocates and go to Harrisburg and vocalize their concerns. And I think that's a pretty awesome thing that you don't hear a lot of from other organizations, but FIGHT kind of stands in that, I think unique. To me, it seems to be a unique component of the organization that, it's like a family there. And so it's pretty cool.
For sure, and not just FIGHT, but there's a long history in Philadelphia as being a center for advocacy around HIV and people fighting for a long time to get more access to pharmaceuticals and clinical trials and just trying to change the narrative and the stigma around all of that. So clearly this education is working, right? And the advocacy is also helping. Although, as you said, there's always going to be challenges and cuts to funding no matter what. In terms of like education for the community, what are your priority areas? Like, what are the biggest challenges you think, like, okay, we really need to teach people about this? Like, how do you, what's your thinking along that?
Well, what just popped in my mind, I know we were talking about, in fact, it's one of our webinars, this series of tech health. In this time of age that we're living in, everything's on social media, everyone has cell phones, everyone has access to the internet, but teaching them how to use that for health purposes or health services. And so I think having, I think that's important, especially our youth that's coming around within FIGHT, having that understanding of how to access resources through technology. I think also, that's a good question. You can talk more about that. Like, what could be our focus? Like, what is, around?
Because, I mean, there's just a lot of things you can cover, right?
Yeah.
Absolutely. Yeah. I mean, a lot of the work that we do is rooted in prevention, treatment, and justice. And we look to expand outward from that. We rooted in HIV and AIDS activism and advocacy. But beyond that, I talk a lot about allied issues. So housing and homelessness, the opioid epidemic, and kind of how all of those intersect. That's really important to us, and really kind of addressing that and how they're all connected. So tech, health and wellness, for instance, is something that is important to the work that we do. So it's very broad and far-reaching.
Yeah, definitely the opioid epidemic, especially now as the city is proposing to open a safe needle injection site and or a drug injection site. There's a lot of controversy around that, but I find there's also a lot of ignorance, right, in terms of the motivations behind that. And I talked to somebody who worked at a needle exchange or works a needle exchange program, and she said one of the main reasons is to reduce the spread of HIV and hepatitis C and tuberculosis, and by giving them the clean needles, they have effectively reduced the number of cases. And I think a lot of people kind of like miss that connection in terms of like why they, these sites sprung up, and that how these safe injection sites might be an extension of that as a kind of like public health reason. And so again, I think these forums give an opportunity for people like that to maybe express these points of view that might not be seen in the mainstream media. Because there is like a lot of, even today in 2018, right, there's like still a lot of misinformation. And so that's probably one of your biggest challenges, right, is like trying to give people the right information.
Absolutely, and that's why partnerships are really important. To speak to the opioid epidemic, and many of the planning partners that we work with Prevention Point. They're the experts in
That's
this.
where she worked.
Yeah. They're the experts at this, and we consider the Community Health Training Alliance to be conveners of those experts. Folks who have roots in the community. Prevention Point has been doing this work for years, and we give them the platform to do Narcan info session and training at our prevention summit. So that's just one of the things that we prioritize and pride ourselves in.
That was one of the other things she mentioned, is being able to have Narcan to be able to revive people, and that there was a lot of misinformation around Narcan still. So again, it's good to see these like connections happening, and that we're all kind of like trying to come together to be on the same page. So we're going to take a short break, but when we come back, we'll have more People Power Lunch Hour with Kyle Chvasta and Dr. Tashina Okorie. And they are both with the Community Training Health Alliance, CHEETA, or Community Health Training Alliance. And they work with Philadelphia Fight. We're talking about the programs and education that they offer for the community and more. Stay with us. You're watching the People Power Lunch Hour on Philly Can TV and listening on WPPM 106.5 FM. We'll be right back. back to the People Power Lunch Hour Show. I'm Vanessa Maria Graber, your host. And today we're talking with members of the Community Health Training Alliance, which is a really great program out of Philadelphia Fight that works with a variety of community partners to provide health education and resources to members of the community surrounding issues of public health and more. I'm joined in the studio with Dr. Tashina Okorie and Kyle Chvasta. They both work with the Community Health Training Alliance. We've been talking about some of the programming that they've been doing. So this month is African American History Month, and they will be presenting some webinars. And one is going to be happening on Friday at 12 p.m. So if you want more information, you can check out their website. In March, they're going to be celebrating Women's History Month. And then in April, they're going to have Philadelphia's first anal health symposium. They have a whole calendar year of events, so make sure you check those out. So during the break, we were talking about how FIGHT continues to expand and grow into other areas, and also the Community Health Training Alliance, which kind of grew out of June's AIDS Education Month. Can you talk more about some of the other growth areas?
I'm going to speak to the pediatric.
Oh, yeah. We're opening a pediatric clinic, for instance. That's really great and exciting. See, I had all this figured out on the break.
A new AIDS library just
Yes.
opened
The
as
Critical
well.
Path Learning Center.
Yeah.
That's going to be actually amazing.
Yes, yes.
This is almost sort of like it's not a drop-in center, but it allows people to come in during certain hours, of course, to, kind of hang out, to get educated, to learn how to use computers, and become more literate and familiar with, how to use technology. I'm excited about this whole the laundry service that we're offering to those, who are in need of, those services. And I think we're creating an area where people can come and bathe, and different services that I think is really welcoming. It definitely has a warm feel, and so we have information. It's gonna look awesome. I'm excited about the transition and what it's going to bring in terms of resources to the population that we're servicing, and even more. They'll tell a friend, they'll get excited about it, and they'll have other people come out, and we'll raise up more leaders and educate them, and they may then turn to want to enroll into one of our teach programs. And so I think it's a great thing that's happening with our AIDS library transitioning to the Path Learning Center.
Yeah, we definitely need more public spaces just in general, so it's really great that FIGHT is able to facilitate that for the community. So your background is in social work and now public health. What sort of attracted you to this helping field and working with families and, and connecting them to resources, educating them?
So they say when people enter, public service field, we have some life experience of our own that draws us to the helping field. And so being a social worker, we've experienced, very many different tragedies, the need and the population around. Like, I worked in substance abuse for a really long time, and so looking at the need of understanding relationships, family, the dynamics, of what's happening, not what's wrong with the person, but what happened to them that they found themselves in a situation. And so, even through my own lived experience, I'm also HIV positive, and so I have an understanding of what it's like being on the other side, being the professional, but also having that lived experience. And so I understand the need of needing to break stigma, to educate folks about what it's not, to connect people to different resources, to really build yourself back up into a place where you're confident again and feeling self-love again, because there's a time in your life when you go through periods when you're diagnosed with, whether it's cancer, HIV, hepatitis, whatever the case may be, it takes a toll on your mental health. People may fall sick of depression, have thoughts of suicide, and so being a social worker, but also a person who has that lived experience, I get it. And so it's important to educate families or individuals, other professionals, about the importance of maintaining an empathic stance. I think what happens oftentimes in this field, our professionals may become a little burnt out. to put it that way. Every day you're dealing with the problems, you're hearing the war stories, you're hearing things that's really hard, and day in, day out, sometimes we don't take care of ourselves. So then they too need the care. And so part of the education is bringing awareness to not just the community, but also to professionals. Like, hey, how are you dealing with this? Let's talk about self-care food. Let's talk about different ways that we can be better accessible, or maybe better able to provide services to our individuals, so as you take care of yourself. And so being on both sides of those worlds, I think attracted me to Philadelphia Fight. It's like, hey, I like this. I like the whole idea of educating and meeting people where they are. And, I know they're really big on harm reduction and, just, to help those individuals or even families alone where they may feel like there is no help. Where you're in a place of, this feeling hopeless.
Mm-hmm. Yeah, I think burnout is like a real issue that affects a lot of people in this field, as we laugh, And I think it would make a great workshop topic.
Yeah.
And so if you're out there and you're listening, they're accepting workshop proposals.
Yes.
But it is something that I think is directly attributed to budget cuts and loss of staff and still having to be able to serve all these people or working more and doing with less. And, Philadelphia is the biggest, poorest city in the country, so we have a great need here as well. And it does become overwhelming, and it does become hard to wrap your mind around all these problems, especially when people are dealing with multiple things. They have health issues, they have money issues, they have relationship issues, and environmental issues. And it becomes a lot. So we have to take care of each other, right? Because Valentine's Day, right? We have to spread the love, and we have to take care of one another. What brought you to this field?
Oh, yeah, no, absolutely. I always say I became a social worker by accident. My background is actually in art history, with a concentration on American pop culture. But when I graduated into the recession. So I was kind of like knocking around at different food service restaurants. I don't know why I called it
It sounds better. Right?
Yeah, it sounds better.
I've been there too.
Yeah. I was at Starbucks for 3 years, but I actually ended up doing sex work. So in that field, I realized that there was a lot of injustices and a lot of like lack of resources, and I became back in Jersey an advocate and activist around sex work, and just getting folks to healthcare and things like that. And came to Philly, became a social worker, and realized that there's a huge contingency of like activists like in that field. So and here I am at Fight doing that work. So
I love people that work at Fight. Everyone has such a interesting, compelling story. It definitely shows something about the kind of people that they hire, And I think it's really great to know, it's great what your work and your job titles, but to know the people behind that are doing this work that can empathize and can share their experience as well. So thank you both for sharing that story. Do you find that some people are a bit shocked because of the stigma when you do share your background?
Yes. I say that because when, I share my story of also living with HIV, people, I think it's shocking to me that people still think there's a look.
Right.
Mm-hmm. And they'll look at me and say, you? I'm like, yeah, me too, and so it's important to, educate people, even the younger generation coming up who are not really educated about that, and they think they still think their understanding of it is based on what they've been taught, and unfortunately that's still grounded in some ignorance of not knowing how far it's come. And so I've heard, I still hear, things that I'm still shocked behind about how you contracted, or the assumptions of how you've contracted it, even some of the microaggressions you experience from people who don't have a full understanding towards those living with, HIV. And so I'm still shocked by the level of ignorance that still exists out there. And I think when sharing, people are shocked to hear of how far it's come. And in the medication that are out there. And they're like, oh, I didn't know that. I'm like, yeah, that's why it's important to be educated. But then you think about it, those who are not really affected with it, family or friends, they may feel like, why do I need to know about it? Why do I need to seek information about HIV and AIDS? And so I think it's an important thing that we're doing with AIDS Education Month to kind of put it out there and do these webinars and advertise it and market it so people can get the word out, to those, who don't know, who'll say, let's check this out and learn more about what this is. And so.
Yeah, I mean, it's part of why we do this show, because there's just so much misinformation still. And, the average person who maybe finished school a long time ago maybe is not exposed to workshops and education or people. So their assumptions and their knowledge is like very old, right? And there haven't maybe been people around to challenge those assumptions and explain to them. And I think it's important that we keep having this conversation and we keep putting it out there. And hopefully with our collective effort, we can like change the narrative, right? Because there is no universal look. There is no one way people contract HIV. And some people are born with it. I mean, there's like a million ways, right? And so it's nice to have people on this program that can kind of like change the stereotype and say like, oh, wow, you're a doctor, you know what I mean? Like even stuff like that is like this, it could be anybody, and it doesn't let you stop you from achieving your dream and living your life and being fabulous and awesome. And so that's really great. And we've had other people on the show too that, again, like just living their best life and not letting it stop them from anything. And one of the things I wanted to talk about was something was mentioned on our show before, which is what it means to live with the virus dormant in your system. Because I think it's good to talk about that, because I feel like that is a huge advancement because of the medication and the treatment that's been available to people that a lot of people still don't fully understand.
Well, it's exciting times because there's a movement called U equals U, means undetectable equals untransmittable. And so that's huge in the HIV/AIDS community because it dispels the whole thought process of I can catch it if I have sex. While you still want to protect yourself, you still want to learn more about other protective measures to protect yourself if you decide to engage in sexual activities like PrEP and things like that. But I think it's huge for those living with the virus because now we can feel like I can have a normal life, and I don't like to say normal because then what is how do we identify or define normal? It's all subjective, and so but for us living, it's like wow, I can live. I don't have to be afraid or think I'm going to die because that's how it kind of played out when it first came onto the scene. And so with the medication, there were times where people were taking a cocktail of meds. Now some of us are only taking one pill, which is huge. That's huge because, you went from 30, 40 pills to just one, and it's different for each person, but that's another kind of stride that has been made in medicine where, women can have children and the kids aren't born with it, you can have, partners, you can be in a marriage and the partner not be afraid that they're going to contract the virus and so I think, there are talks of cure now. And so that was something that was never mentioned years ago. And so they're having, running different research studies to see how, to make that possible, for us living with the virus. And so I think, the medication and the things that's been happening within medicine is huge for us. It gives us hope that there's life after diagnosis, You can still be fabulous, as you said, and still enjoy being who you are.
And being healthy, because I think that fear, is what really, affects people's mental health, right? That fear of dying, the fear of getting really, really sick and being a burden on your family but that's not the case. As long as you take your medicine, though, right? That's
Yes,
like very
you have
important.
to take your medication as prescribed. If not, unfortunately, if you stop taking it, of course, you will fall sick. But you know, you take your medications and you see your doctor regularly, you're okay. But you said something I think is important because when you're diagnosed, even living with it, sometimes it does plague with your mental health, worrying about, you know, if I fall sick, is it because of this? Well, I developed this. Well, this happened to me. So I think even living with the virus, you still have to remain educated about what's happening with your body. So making sure, you know, you're healthy and you're eating right and, you know, making sure your cholesterol is good, like you should do anyway, you know.
You can still die of cancer, right? Or diabetes, right? So you have to still take care of the rest of your parts of your body.
Yeah, right. Absolutely.
Yeah, and can you talk more about PrEP? Because I think that's another thing people still are not aware of, that it's a resource, that it's new medicine, and that, again, all these things are connected, like funding science and research and testing and medicine, like leads to innovations like this, and then that ultimately funds the work that you're doing, like teaching people about it, letting people know that it exists, right?
Oh, absolutely. Well, once again, I'm not the expert on PrEP, but that's why we convene experts on things like PrEP.
Sure, but you have a general understanding.
Yeah, but PrEP is pre-exposure prophylactics, which is a pill that you can take once a day that reduces the risk of contracting HIV by a significant percent. I want to say 99%. Don't quote me on that. I'm sure there is resources for PrEP or numbers for PrEP on our website, actually. And you could actually get access to PrEP through our website as well. So fight.org, you could get a link to that. So, but it's wonderful that it's there and it's available, and we need to increase access to it, you know, which is what a lot of folks are fighting for, and increase information on PrEP to the public. We've also had PrEP workshops, not to keep plugging the workshops, but folks each year since it's kind of come on the scene have proliferated information about PrEP, you know, regularly at our prevention summit. So.
Yeah, no, and it's worth repeating, right? The workshops, the education, the resources. We all can benefit from it. I want to kind of end in the last segment with sort of your vision for the future, right? Because I like to end on a hopeful, optimistic note. And right, we do this work for a reason, right? Because we believe in another world. We believe that change is possible. What are your hopes? Not especially you, since you're like new to fight and you started doing this program. Like, what are some of the things that you hope will grow out of this, or you hope to achieve through this work?
I think the vision for me coming in, learning more about with the Community Health Training Alliance is how it became to be. My hope is that we're continuing to be change agents, and change agents in a way that people are changing the understanding of information that they thought they knew about HIV and AIDS or other allied issues. But I also wanted to be fun. I want the community, the cheetah, we call it cheetah for short, right?
Yeah.
You need like a cheetah mascot.
Yes, absolutely, right? So we looked into that together. We had downloaded some pictures of actual cheetahs. And so we got to talk about what they would look like and how it could fit into, you know, our fights, you know, programming of our website and things like that. And so we are looking to make it fun and having some Fun Fact Fridays. So we're listing information of different, you know, public health issues and like facts that no one knew about this health issue, whether it's cancer, whether it's hepatitis, whether it's homelessness, something that people may not have been aware of. And so we're looking to put a lot of those together to post it on our website and, you know, branding ourselves so people can know who we are, what we do, you know. We even had talked about having a cheetah TV, you know, just kind of brainstorm different things and make it creative and fun, engaging for people want to come to the website and say, oh my gosh, I learned this, I learned about that, and this is pretty cool stuff that they're offering the community to become, you know, more aware. So the goal is to increase awareness and to continue to be change agents in a way that we're creating a shift in a mindset, maybe even a paradigm shift on a celebrity, if you will, you know.
You got to think big, right?
Yeah, right. So,
What about for you?
Yeah,
I mean, your program has already grown, right? So
yeah, I mean, it's gone through so much. I mean, I ultimately hope that the Community Health Training Alliance continues to be conveners of like experts and experts that have like deep roots in the community. I think what is great about the Community Health Training Alliance is that we aim to uplift the voices and experiences of folks with lived experience and prioritize that leadership within our program. You know, I think the vision for the Community Health Training Alliance, you know, I just hope that we continue to do really good work and provide really good educational programming that's honest, you know, that focuses on, that is rooted in the principles of prevention, treatment, and justice, but expands outward and just gets bigger and better, and I think we can do that.
We can do that.
it has lots of people wanting to participate, right? You always want to grow your numbers and make sure that people know about it. So that's why we're here, right? To promote it, let people know. So again, if you're just tuning in, I am speaking with members of the Community Health Training Alliance. They work with Philadelphia Fight. I have here Kyle Chvasta and Dr. Tashina Okorie. And they are facilitating the Community Health Training Alliance workshops and webinars and all of the events that they have through the year. So if you can just tell them one more time about what you're doing this month for African American History Month, and then how they can sign up online and get access.
So as we've been talking, you know, on this segment, we've had a year worth of different events and webinars that we're putting together. This month, in fact, on Friday, we have our first webinar called Nothing About Us Without Us taking place. So we're excited about that. And so all are welcomed. We go to our website, fight.org/cheetah, CHTA.
Not cheetah, but
Right,
CHTA.
CHTA.
We'll post a link on Philly Cam social media so you can see it.
And we have other workshops coming about also in March too. So we're excited about that. And so lots going on, lots happening, good stuff happening, some innovative things we're going to be try to do, you know, throughout the course of the year. I think our main focus is, you know, making the summit a memorable one. And so we are looking for professionals, you know, people with experience to submit workshop proposals.
Is that in June, the End AIDS HIV Prevention and Outreach Summit at the Convention Center?
Yes.
Okay.
And so we're looking to promote that. So people can submit their workshop proposals to be considered as a presenter on various topics. And so if you go to the website, fight.org/cheetah, or our AIDS Education
Yes.
Month. Well, both of them, AIDSEducationMonth.org, you get to see our the tracks of the different tracks that we're offering that you can submit or speak to submit your proposal, and it actually shows you, it sends you to a link you can actually submit your proposal, and it gives you a guideline on what to do and how to, you know, create your proposal. And so, yeah, all are welcome. If you know someone, you know, if you're an organization, if you're watching, we'd love to have you to be a presenter at our Prevention Summit. So just check out our website and submit your proposal. Right?
Deadline is March 2nd.
Yes.
March 2nd, but it's a super easy process, and we're here to help you out.
Yeah.
And you're looking for people who are involved with the community, who have some area of expertise, some lived experience, a story to tell, or just some knowledge that you're willing to share with these communities that would be useful. So make sure you check out the website, go to philadelphiafight.org. They have many, many resources in addition to the Community Health Training Alliance. Just some of them include the John Bell Health Center. There is a youth health center. There is Clínica Bienestar. Again, we need that for the Spanish-speaking population, the Pediatric and Adolescent Health Center. There are some behavioral health clinics, too, if you're in need of mental health treatment, the Diana Baldwin Clinic and the TREE Intensive Outpatient Treatment Program. And another area of education, Project Teach. So if you want to check out that People Power Lunch Hour, featuring members, organizers from Project Teach, you can go to our website, phillycamp.org, and learn all about that. But there's all different kinds of Teach, Frontline Teach, Project Teach. Latino teach, again, Spanish speaking, faith-based teach, women's teach. So many programs. There is the Critical Path Learning Center and Library, which is a community center and educational commons where people can come and drop in and learn more. And as you said, there's a new laundry facility and much, much more. There is literally a wealth of resources and most importantly, a community that supports you out there without stigma.
And may I interject? We are working on the Critical Path Learning Center. Yes. It is currently under construction.
Okay, so stay tuned to our website for its grand opening, right? Yes. And I'm sure if you want to donate and contribute to its success, you can do that at the Philadelphia Fight website as well. So this is an important issue. We hope whether or not you're living with HIV that you'll have an open mind and you'll have a willingness and compassion to learn more about public health and to seek out some of these free resources. Tashina, Kyle, I want to thank you so much for joining us on the People Power Lunch Hour Show. Again, once more, the website is philadelphiafight.org. Make sure you check out the Community Health Training Alliance, CHEETA. And if you are a designer out there that want to draw a nice cheetah for them, yes. Sure, also contact them. All right, I'm Vanessa Maria Graber. That's going to do it for this edition of the People Power Lunch Hour Show. We'll be back next week with an all-new episode. You can check out this episode and all of our episodes at phillycam.org. And if you would like to make your own media, please come attend a free information session at PhillyCam. You'll get a tour. You'll learn all about our media education classes, our production facilities, and more. Again, that website, once more, is phillycam.org. Make sure you follow us on Instagram, Twitter, and Facebook at PhillyCam. All right, we'll see you next week. Thank you for watching and listening.